Instant Neuro! Neural tube defects may occur when the neural tube fails to appropriately close, or when the cerebral hemispheres fail to separate. Neural tube defects may be detected prenatally by examination of amniotic fluid or ultrasound. Spina bifida is a general term for neural tube defects affecting the spinal region. In this condition, the vertebrae fails to fuse dorsal to the spinal cord. Spina bifida is associated with low folic acid intake and may be prevented by increased folate intake prior to and during pregnancy. Subtypes of spina bifida vary in severity. In the case of spina bifida occulta, the vertebral defect is covered by skin. Often a patch of dark hair grows over the area. If a fluid-filled sac of meninges protrudes from the defect, this is known as spina bifida with meningoceal. If neural tissue is also contained in the protruding sac, this is termed spina bifida with myelomeningocele. If the neural tube does not fold and remains exposed, it is called rachis, and the neural tissue is likely to become necrotic. This represents the most severe subtype of spina bifida. When the herniation of the meninges involves the region of the brain rather than the spinal cord, it is referred to as encephalocele. If neural tissue is also contained in the protruding sac, it is termed meningoencephalocele, and if the protrusion includes the ventricles, it is called meningohydroencephalocele. Anencephaly occurs when the neural tube fails to close cranially. In this condition, the vault of the skull does not form and much of the cerebral hemispheres are absent. Anencephaly is associated with maternal type 1 diabetes and insufficient maternal folate intake. Holoprosencephaly occurs when the left and right hemispheres fail to separate and is typically fatal. Holoprosencephaly may be related to mutations in sonic hedgehog signaling pathway and also occurs in fetal alcohol syndrome. Holoprosencephaly may result in a cleft palate and extreme cases result in cyclopia. Instant Neuro!